So hello once again and warm welcome to you all. If you are here today, it is because of the full learning cycle of the IA2030 movement for Immunization Agenda 2030, which started last Monday. That was on the 7th of March 2022. And this is our second technical support session since we started the full learning cycle. And the technical support session is it's not for everyone. It's for, I think, I usually say two categories of people. That is, the first category is those people that are crying for help. They have sent out an SOS. They need help to use the platform. They need help to access the platform. They need help to recover their password. They are not able to see their progress on Learning.Foundation. They are not able to access the ideas engine to submit their ideas. This session, that is for this very first category of people. Now, the second category of people are those people who, with the spirit of peer support and solidarity that characterizes the scholar community and immunization professionals, they come not because they have a challenge, but because they want to extend a hand of help to their colleagues in need. So you are all warmly welcome, no matter your category. And this is just one of the ways in which we are able to support you. We also have our experience sharing sessions every Tuesdays and Thursdays with Dr. Francois Gas and myself, but the technical support session is every Wednesdays and Fridays. So today I have two questions for you. My very first question, and I'll do it like a quick poll, is you type a yes or a no in the chat. Type yes if you have completed all your tasks in your Learning.Foundation dashboard. So my question is, have you completed all tasks in your Learning.Foundation dashboard? Type a yes in the chat if you have done so. If you have joined the at least if you have joined the dashboard, can you type yes? I see Dr. Imran. That's great. Laurencia Caesar. That's great. Type yes. Type no if you have not yet joined. If you have not yet joined, if you have not yet joined Learning.Foundation, if you have not yet seen this screen that I'm projecting right now, I know this is a Reda's own dashboard that is showing here. If you have not yet seen this dashboard, can you type a no in the chat, please? So I'm going to be reaching out to those who have not yet typed. I want to ask Nnam. Nnam, I'm asking you to unmute yourself. Okay, so it means everyone in the room has been able to join their personal space on Learning.Foundation. That is wonderful. Now, the next thing is sharing an idea in the ideas engine. Have you already joined the ideas engine? So if it's, I'm just going to show the example. I'm going to show the example. If you have joined and shared an idea in the ideas engine, okay, Uzinku says yes. Okay, me too, I say yes. So if it's no, I know Dr. Imran Khan said earlier on that he has not yet joined the ideas engine, and he would like us to guide him on how to access the ideas engine. So I'm going to invite him to unmute. And I'm glad to see that Ian Steed, he is our maestro as far as the ideas engine is concerned, is here. And Ian, I'll just want to invite you. Nnam also says no, so, invite you, Ian. There is something new, something has changed about accessing the ideas engine. You have tried to make access easier for everyone. So please, can you tell us what has changed?
Thank you, Charlotte, and good morning, good afternoon, everyone. So what we have done, we have opened up a second way to access the ideas engine, which I think will be useful to some people. So if you're already in the ideas engine, nothing changes. If you haven't made it, when we get to that part of the meeting, I will suggest a second way of joining the ideas engine.
Okay, thank you so much, Ian. We are actually in that part already because I want to invite Dr. Imran Khan. Dr. Imran, you volunteered to share your screen, so that you can access the ideas engine. And thanks, Ian. Ian has just shared the link in the chat. So I'll stop sharing my screen so that Dr. Imran, you can go ahead and share yours once you're ready.
And Charlotte, may I suggest that anyone who hasn't joined the ideas engine at this point clicks on the link in the chat and we go through it all together.
Okay, yes. So Dr. Imran, Nnam, you also indicated that you have not yet joined the Ideas Engine. So Ian has just shared a link in the chat. Can you click on that link? And Dr. Imran, are you able to share your screen? And can you also click on the link that Ian?
Yes.
Okay. So you go to the chat. I see you're already on the dashboard. Congratulations, that's great. So are you able to see the chat of this Zoom call?
Yeah, I'm seeing.
Yeah, so, okay, can you click on the link that Ian has just shared in the chat?
Okay.
That's wonderful. So that is the easiest way now to access the Ideas Engine. Okay.
Okay.
Okay. Do you already have an account in the Ideas Engine?
Yes. No, I don't account.
You don't have an account. It's your first time of accessing the Ideas Engine, right? No,
okay.
This is different. Go back to the Ideas Engine page.
Okay.
Yes. So this is your first time of accessing the Ideas Engine, right?
Okay.
Yes. So you need to register for a new account.
Okay.
Mm-hmm. Okay. So that is, you need to put in that information, your email address. And I'll encourage you to use the same email. Yes. You put your first name. That's good. And then the display name is optional. Yeah. So what is your role? So you click, there is, you choose. Okay. And your system level. Great. And where you're located. So now you have to type in your password. It depends on, yeah. Great, confirm the password.
Can I register myself now?
Yes, go ahead and register. So you need to scroll down to be able to click on agree. Yes.
Okay. So this is Charlotte, if I may come in, and Dr.
Yes,
Imran, thank you so much for sharing that. It's it's perfect to see you demonstrate that. What you now have to do is go to your email, and you will receive an email from the Ideas Engine to the address that you've registered. That's the one. So it's from noreply@wazoku.com.
Yes.
And this is to confirm your email address. You click on the blue link as you've just done.
Okay, are you seeing, sir?
We're
yes,
seeing it very well. Now it's asking you to re-enter your password. Confirm your password. And now, it's taking you around to do the terms and conditions again. I wasn't expecting that.
Okay.
And this should have the data that you shared earlier. We'll just check that. Oh no, it's okay. So there's a little glitch here that you're going to have to share your data again. So your role, level of health system, and country.
Yeah.
Sir, when I scroll it down, so there are 3 options which is required here. Your role.
So
can I enter it again?
Yes, please go ahead and enter it again. Thank you.
Okay, thank you. Thank you for guiding me.
Yeah, and you update your profile.
Can I put my picture here?
Yes, you can put your picture. That's great. If you want, you can go ahead and put your picture now.
Okay, thank you. Just a minute.
It may take a bit of time. If you're just joining us, warm welcome to you. And we are happy that Dr. Imran Khan is demonstrating to us how to join the ideas engine, and he's actually just trying to update his profile.
Madam, I think the picture is not uploading right now, so I will do it later on.
Okay, no problem. You can always come
Okay,
back anytime.
you.
So you just need to click on update. And that is it. Your profile is updated successfully. So here
thank you.
Okay. So here is the home page of the ideas engine. You see that ideas can be submitted according to IA2030 strategic priorities. So Dr. Imran, I'm going to ask you a question.
Okay.
If you are to submit, do you know what you're going to submit as idea in the ideas engine? I'm not able to hear you. I was asking, do you know?
Sorry, my internet was unstable for a few seconds. Yes, I know. I want to put my ideas and practices here. For example, I'm working in an area. What the problem here is due to which the immunization code is not occurring very well. So I will be put my ideas practice here and this.
Yeah, so which strategic priority does your idea fall under? If you talked about coverage, it probably is going to be SP3.
Yeah, no. It's on SP2, commitment and demand.
Okay, commitment and demand. All right, so please, can you just click on commitment and demand? Okay, that's great. So when you click, you can, if you want to add your idea, you can just, you see here that there's that introduction. Yeah, you read the introduction, you see the key focus areas, and then you can click on add idea.
Okay.
So once you're there, you say add idea to SP2 commitment and demand. So the first thing is, it's always good to read, and then what title can you give? So in about 100 words, how can you summarize your idea? That will be your title. So you summarize your idea, you give it a title, and then you come down. There are a series of questions that should guide you to on adding the details. So you select category. Can you just, so you make sure that you select the English language, and then select value. Okay, so is it an existing practice you have done or directly observed? That's great, you already chose it. And then describe your practice. What are the concrete actions you are taking or have taken? Who does what, when, where, and how? So we are asking you to be specific and detailed so that readers can understand your practice. And there are some questions that you need to consider. Why is this practice important? How did it develop? And who does what, where, when, and how? So you can write up to 5,000 words. All right, so can we just go down a little bit more to see? All right, so the next thing is, how are you measuring implementation of your practice? So what have been the results so far? What have you observed? And you have to also select the level of the health system that is being implemented, where the practice is being implemented. Okay, in your province, that's great. And then are your actions included in the Ministry of Health plan at your level? So is it something, is it a practice that is already included in your plan? You can answer yes or a no. And what is most important that you have learned? So it's always good to come up with maybe lessons learned as far as the practice is concerned. So you can put down the lessons that you have learned from there. And how does the idea or practice that you are sharing relate to COVID? So there too, you are selecting, you click on the little arrow to see the options. So you say it's related to COVID-19 vaccination, it's related to recovery of routine immunization services. It is not related at all. So it's good to make a choice there. Okay, and the key area of focus. So earlier on, we saw SP2, we saw the difference. So you look at the key area of focus. Does it fall under commitment, sub-national support, depending on the strategic priority that you chose? Okay, that's great. So, okay, so That's great. So if there are any other documents that you may want to attach, to maybe to corroborate your practice, maybe some resource that can help another person elsewhere to see how they can use your practice in their day-to-day work, you can also click on the plus, the attachment button that's under. But before you submit, you have to check the following. Have you chosen a good title? Have you chosen a strategic priority and key area of focus that best covers your idea of practice? And does what you have written answer each of the questions: what, where, who, when, why, and how? And I want to congratulate Nnam, who says, I'm following, and you are on the same phase as doctor. So once you have done that, if you have filled in all the information, you will be able to save your idea either as draft or publish it for others to see. I'd like to, Ian, I want to ask you a question. Ian, I noticed that at times, like right now, when does the save as drive icon becomes visible and usable? How much information does Imran have to include for him to be able to save a draft in the ideas engine?
That's a really good question, Charlotte, and I'm afraid it's not one that I can answer. I wonder if you have to start typing some text in one of the boxes, in perhaps the title box, but I can't give a definitive answer, I'm afraid.
Yeah, because I thought so too. Okay, thanks, Ian. But just to say, Imran, you can always return later on to submit your idea. So Imran, I want to hear from you. When will you be able to share your idea in the ideas engine?
Ma'am, thank you so much. Today at night, just I free from my office work. So
okay.
Just inshallah, at night I will be completed.
Okay, so I'll be checking the ideas engine on Monday to see if your idea is already there. And why not, maybe on Tuesday during the experience sharing session, you could come by and share your ideas with the other participants that will join us on Tuesday.
Sure. At night I will be completed, and on Tuesday I will be demonstrate and present to my colleague.
Okay, thank you so much. And Nnam, I'm going to ask Nnam to unmute. And thanks so much, Dr. Imran Khan, for
Thank you so much, ma'am. But just I want to ask was question from my colleague that if can there is any option here, select which key area focus best cover your practice or ideas. If it is more than one, for example, in upper session, we select commitment and demand. So just here, there is only commitment and the demand word is not here.
Okay, so what I think is you cannot select more than one, but I think you should select the key focus area that is most covered, covered by your idea.
What I will be share my idea with my colleague is that how we will generate demand in the community level.
Okay, yeah, so I think it's
commitment. I think commitment is on the level of the health facility that or API technician or vaccinator are committed to their work, but how to generate demand at the community level is a big and best question.
Please, can you click on the different options again, Dr. Imran? Okay, so I see public trust and confidence. I see so acceptance and value. I see acceptance and value of vaccination.
Yeah, public trust and confidence. What I click in my initial phase that the SP2, there are 5 area in SP2. So I select all of them because I want to work on the refusal, the community refusal. So that's why commitment, public trust, confidence, and value of the vaccination. Another thing is demand generation, accountability. All these areas I want to touch in my idea. And also nowadays I'm working on it. So okay, if I click on the public trust and confidence, so the commitment and the other things are not coming here in this box.
Dr. Imran, that is not the most important part. That is not even so much what we'll be looking at. The most important part is put in all the details in your idea. So that's the most important part of it all. And we know that most of the key focus areas, they actually they overlap. There are points of intersections amongst all of them. So the most important thing is the title that you're going to give to your idea and the details that you're going to put. Is that okay?
So I means that we write title in 3, 4, 5 lines, but I think if they give a characteristic of up to 100 level, it means that we have to write here in abstract.
No, the title is just a summary, a short summary that says what your idea is talking about. So
Okay.
Ian, I see you've unmuted yourself. You want to come in?
Thank you, Charlotte. It was just to make the point that you've just made, that the title is what other people will see. So it's really important that your title is interesting. It summarizes what it is you're talking about, but you're going to expand on that as you go further down. You're going to add more detail and more content so that people who are interested in your idea will be able to follow it further and explore it in more detail a bit further down.
Okay, thanks so much.
Thank you.
Yeah.
God, inshallah, I will be do it at night, and on Tuesday I will be share my idea with my colleagues.
Thank you so much, Dr. Imran Khan. Yes, right now I want to turn towards Nnam, because I hope you're able to share your screen. I just want to congratulate both of you for being able to access the Ideas Engine. And if you're just joining us, warm welcome to you. We are trying to look at how to join the Ideas Engine via the link that my colleague Ian Steed has just shared in the chat, and I'm just going to share it again for those who are just coming into the room. So Nnam, are you able to share your screen? Dr. Imran, can you stop sharing? I want Nnam to share the screen, and I want us to look at another aspect of the Ideas Engine. We have seen how to share an idea in the Ideas Engine. Now, how do you get to read other people or to view people's ideas in the Ideas Engine? Nnam, are you able to please go ahead and introduce yourself? Tell us where you're joining from.
I'm called Nnam. I'm from Cameroon.
Okay, so Nnam, can you speak a little bit more louder? And are you connecting with your computer?
No, with my phone.
Oh, with your phone. Okay, okay, no problem. So you're not able to share your screen, but you at least now you know how to share your idea in the Ideas Engine. Okay, that's excellent. Okay, that's great. So and this is okay, that's great. So can you click on the 3 bars at the top of your screen? I want others to see. Okay, you go to see how to view ideas in the Ideas Engine. And it's so great because if one is following on the phone, it means you can also access the Ideas Engine on your phone. So can you click on the home icon? Okay, yeah, so and scroll down a little bit. We want to show how to view ideas in the Idea Engine. So Nnam, which strategic priority is of most interest to you?
Immunization program for primary health care and universal health care.
Okay, so click on that. That's great. So now you see at the top, there is the overview that is just telling us how you can add an idea and all. Can you click on the ideas beside overview? You click on the ideas. We want to see the ideas that have already been shared. That's excellent. And we see here that there are 754 views, 61 contributors, and 50 ideas that have already been shared. So right now, Nnam, I would like you to scroll down a little bit and then choose. And looking at the topics, I know you're English speaking, so we'll focus on ideas that are English speaking. So look at a topic that is of interest to you, just to show that at times, what will make you to stop and read an idea is if the title is captivating. So can you just pick an idea that you think you would like to find out? I see you've selected an idea in French, but please, Nnam, can you go back and take an idea in English so that everyone that is seeing our session is English speaking?
Oh, okay.
So just go back to idea. You can click on the idea icon. That's okay. Yeah, you just you see that little, you see the little arrow, the little blue arrow on the top right hand corner of your screen. Can you just click to that little blue arrow? I know you're having connectivity issues. That's excellent. So now that's an idea in English. That's one way for you to be able to pass from one idea to the next. All right. So let's go down a little bit. The title of the idea is the topic is up. Sorry, I'm going to, the topic is up. So let's look at the title: Leadership and Governance Influence on Vaccine Accessibility. So that is the idea that has been shared here. Okay, so if you go down, some more, we are going to see it's an existing practice that I have done and I really observed. Accessibility of vaccines is solely the responsibility of leadership style and governance decision. Okay, just go down. How are you measuring? We see here that this the colleague has written very little. So there is not much detail as far as the idea is concerned. And it says it's related to COVID-19 vaccination. So let's go down some more. Let's go down to the bottom. And he selected the key area of focus: leadership, governance. So at the end, you can write a comment. If you look at this idea, what do you think? Since the idea does not have much detail, if I were to give feedback to this peer, I'll say, can you elaborate more? What exactly are you doing? Who are those involved? What difference has it made? In my context, this is what I have done. This is what I have done. So you can actually comment. There is the comment section. You can actually comment on the idea to give feedback so that the person who submitted the idea does not only know that the idea has been looked at, read by peers, but can also get ideas on how to improve upon their idea and their practice in their context. Okay, so now we are going to go back up to the top, and then I'm going to show one last thing. One last thing. So now, if are you seeing I'm sure all of you are seeing the 5 stars that are showing.
Yeah.
Yeah. So if you read an idea and you find the idea is interesting, you find that it is compelling, it's an idea and a practice that is meaningful, that could be very useful to you in your context, you can give this idea a star. So now, if you were to rate this idea, do you find that it is useful, it is helpful for you in your context?
Not really.
Not really. So you can give if you were to give it, how many stars will you give? Okay, I see 2 stars. That's excellent. So if you click on the little triangle at the end of the stars, the little black, yes, voila, you see one person, it shows the number of people that have given stars. So you are the first person to actually give this idea 2 stars. All right, so thanks so much for accepting to do this demonstration with your phone, Nnam, and I'm sure those that are here in the room have been able to follow how to access the ideas engine, but also how to view ideas that have been submitted by peers, comment and rate those ideas. Thank you so much, Nnam.
You're welcome. Thank you.
All right, so right now I'm going to go back to sharing my screen. And Ian, you have looked at the demonstration from 2 scholars today, one on how to join the ideas engine, the other on how to join and submit an idea and share an idea in the ideas engine, the other on how to view ideas. So is there anything that is missing in their demonstration today, Ian?
So I think the thing that we're missing is how to search ideas for something that you might be personally interested in. Okay. So, for example, if you were interested in community radio or social media, you might not find that, or you might have to look through a lot of ideas before you found those terms. And there are other ways that we can use the ideas engine to do that.
Okay, so that's, I'm quickly just sharing my screen. And for those who are just joining us, I simply just clicked on the link. I'm practically calling it, maybe it's like a magic link, Ian. I just clicked on the link that you shared in the chat and it brought me directly to the IDS engine. And I want to simply demonstrate for those who are just joining us, not how to register. You know, if when you click on that link, if you have not joined the IDS engine before, you click on register for a new account. That's the demonstration that Dr. Imran Khan did later on. So, but if you are coming back, for a second time, you just need to log in. And I use my computer alone, so I already put in my email and my password is already registered. So I just need to click on login. So once I click on login, and Jan is going to guide me on how to search for ideas. I'm interested in an idea that is around coverage and equity. So I want to find out information around coverage and equity from district level ideas, from district level immunization professionals. Is that a possibility, Ian?
Yes, it is, Charlotte.
Yeah, so I'll go to my interest is, first of all, coverage and equity. So let me just click on coverage and equity.
Okay.
Mm-hmm. So, yes, please.
So if you click on the ideas.
Yes. So here I'm looking for, there is this bar. What are you looking for?
Exactly. So if you type a term that's more specific than coverage and equity.
Okay. So let me think of some that is vaccine improving coverage. Okay.
Okay.
So let me see. Okay, so I just typed improving coverage and all the ideas that have to do with improving coverage, they are showing up on the screen. That is, if it means that they look for keywords inside, maybe not only the titles of the idea, but inside the details, what have been written by the idea owners. So the details are there, they go into it and, you know, dig out everything. So if I want to be more specific, I can say improving coverage at district, maybe level. Okay. So it has been narrowed down to 3 ideas. So now, if I maybe another option I may want to look at, Ian, is maybe I want ideas that are from a particular country. Is that a possibility?
That certainly is a possibility, Charlotte. To do that, so, we need to click on the Discover tab in the top left-hand corner.
Okay, so I'm clicking on the Discover tab.
Right. And this brings us to all the content in the ideas engine, the challenges, the ideas, and the people. So to make this work, we need to have the ideas available. So if you click off click on the ideas, click off the challenges.
Only ideas. Okay. All right. Excellent.
And click off the chat. Okay.
So I want only ideas. Okay.
That's right.
And so I want ideas, I could say, from Pakistan.
Okay. So let's see what comes up with that, and if not, there's another way of.
Okay. Yes. So I have ideas here from Pakistan.
Yeah.
Okay.
And the other way you could do that is to click on the filter button, which is.
Yes.
Okay. And then, so if you follow that, if you click that. If you click on filter, you've come off it, and then user profile, which is the middle of.
Yeah, user profile. Okay.
Okay.
And I want to search by system level.
Exactly. Or.
Okay. So I can say I want provincial. Okay, and you see, as I did that, it has narrowed down the ideas to.
Exactly. So these are provincial level ideas shared by people in Pakistan.
Yes. Thank you so much, Ian. So for you to maybe do a more thorough search specific in terms of country system level, if you know somebody's name and you want to maybe look for their idea, I can decide. So on Monday, when I'll come here, I'll just type Dr. Imran Khan, because I know by that time he would have submitted his idea, and then it's going to show up. I go to Discover, I click on Discover, I come to system level. If I want to search by country, so you have the possibilities, I think, are unlimited. Thank you so much, Ian, for that. And I see Laurencia Caesar that says, I love this session. And I want to ask you, Laurencia, what do you love about the session? Have you been able to join the ideas engine? What have you learned that is new today? Laurencia, I'm asking you to unmute. I hope you're able to do so. Okay, maybe Laurencia is having a possibility to unmute. So I think we have covered how to join the ideas engine today. But at the beginning of the session, I asked 2 questions. Many of you had not yet joined the room. The first question was if you have been able to access your personal space on Learning.Foundation, and the good news in the room was everyone had been able to access. So now, for those who are just joining us, I'm going to ask this question again. Have you completed all tasks in your Learning.Foundation dashboard? Have you been able to access this space that I'm showing on the screen? If you have been able to do so, can you type a yes in the chat? If you have not been able to do so, please, can you type no? Even if you typed before, I just want to do this final poll before we go. So I'm typing yes. Nnam has typed yes. So please go ahead and just type yes in the chat. Fanny, yes, that's great. Dr. Imran Khan, yes. Please type yes in the chat if you have already accessed this space on Learning.Foundation. Type no if you have not yet accessed it. Bernard Boateng, please, can you indicate, type yes or no in the chat? Hamza Aminu Fago, can you indicate? Jamil Bashir Fago, okay. Can you indicate Jedida Musioka, Joseph Ngugi, Margaret Ayorinde, Mark O, Gold, David, unfortunately, Gold David has not activated his microphone. So Gold David, if you had not been able to get the sound, you have not turned on the audio. So please, can you click on join audio? I know he can't hear me, so I'm actually just speaking to myself, but it's join audio, and then the next step is call using internet audio. I hope you're able to see that, Gold David Suberu. So it's great to see a good number of yes, but there are some no's. I see Hamza Aminu Fago said no, so I'm going to turn towards Hamza. And I'm sorry for taking you over the 30-minute mark for this session, but if you are busy, and we do respect your time so much, you can already go if you don't have any challenge, but I'm going to stay back so that and ensure that Hamza Aminu Fago is able to access his space on Learning.Foundation. So I'm inviting Hamza. I hope you're able to unmute yourself. Hamza, okay. Hello to you. Hello, Hamza. We can't hear you. Okay, unfortunately, we cannot hear Hamza, but I'm just going to do maybe a quick demonstration on how to access your personal space on Learning.Foundation. But the first thing is you need to have the link to access Learning.Foundation, and I'm just going to put in that link in the chat, how to log into your personal space.
Yeah,
but one So unfortunately, I'm not able to hear Hamza.
Hello, good afternoon.
Afternoon, Hamza. I can hear you. How are you doing?
I'm fine.
Okay, so what is your difficulty?
Actually the problem I am facing is because I'm in a rural area. It is a problem of network sometimes. That is what's making me finish my task in my dashboard actually. But I have done only one thing. I think that is the only task I have done in my dashboard. So, but I'm not been able to finish all the tasks that are assigned in my dashboard.
Excellent. So you have been able to access your dashboard, but you have not completed all the tasks because of connectivity issues.
Yes, exactly.
Okay, so anyway, it's good to know. I'm happy to see that everyone in the room has at least been able to access. And I understand the connectivity issues. It happens to everyone. I have those same problems every now and then. But one thing, one key that has always kept me going and us going is that no matter how shaky the connectivity is, we do not give up. So we keep trying and trying and trying until it works. So I hope that will work for you.
Okay, thank you very much.
Thank you too.
Thank you.
All right, so I just put in the link, the quick access for you to log in if you have not yet logged into your personal space or learn.foundation, but I see everyone in the room has been able to do so. So I'm going to thank you once again for joining us and participating in today's technical support session. This is not the last one. These technical support sessions, we have them every Wednesdays and Fridays. That different times. I think on Wednesday is 4:30 p.m. Geneva time, and on Friday is 1:30 p.m. Geneva time. So please go ahead and join. And then I'm looking forward to seeing you all on Monday for the Global Assembly. I hope you have all received your summons for the Global Assembly on Monday, 5 p.m. Geneva time. Look forward to seeing all of you there. Hope you come to share your experiences with us as well as with peers. And then we have our experience sharing session that is on Tuesday with Dr. Francois Gas and myself. We had a great session Tuesdays and Thursdays. We had a great session yesterday with some very interesting ideas that came from different countries. So we do hope that you'll be able to join us. That is next Tuesday and Thursday. And if you have any issues to access any of the platforms, please don't hesitate to join the technical support sessions Wednesdays and Friday. Wednesday, 4:30 p.m. Geneva time. Friday, 1:30 p.m. Geneva time. Once again, if you have not yet accessed the Ideas Engine, you joined when we had already started the session. I'm putting the link for you right here in the chat. You can click on that link to access the Ideas Engine. It is very easy. If it's your first time, you have to register a new account. If it is not your first time, you just need to log in and you'll be and accept obviously accept the conditions and the user agreement, and then update your profile, and you'll be good to share your idea in the Ideas Engine. So I just want to say one thing also. Some people keep complaining that they don't know how to follow maybe the different sessions because they miss the times. The easiest way is subscribing to the Immunization Agenda IA2030 movement calendar that I'm just sharing this chat. That's the easiest way for you to be able to register all the sessions and the events in your own calendar so that you can get reminders when the time for the sessions want to start. So I want to thank you once again for joining us today. Thanks, Dr. Imran. Thanks, Nnam, for sharing your screen and showing us the processes as far as accessing and sharing ideas in the Idea Engine is concerned. Thank you, Ian Steed, for the support and for the guidance as well. And everyone, wish you an excellent weekend and look forward to seeing you on Monday. Bye for now.
Thank you, Charlotte.